So diagnostic test for musculoskeletal system. So definitely in this section, we are going to talk about the name of the diagnostic test, their purpose, and description. Also, nursing, intervention, or implication. Before the diagnostic test, what you has to tell your patient. It is very important, has to know. Basically, the diagnostic test we use for musculoskeletal system, most important and first, what are the tests we have to do? This is called radiology or X-ray of the bones. X-ray of the bones, X-ray of the joint. X-ray, radiology. Then we have to go for MRI. MRI means magnetic resonance imaging, MRI. Then we do for bone scan. It is usually bone scan. We use the radioactive material injected to visualize the bone. Also, another most common technique we use for diagnostic and treatment purpose is called arthroscopy and arthrosynthesis. We are going to give a focus in these two. One is arthroscopy and arthrosynthesis. So the first one here, the radiographic and magnetic resonance imaging. Radiography, we said, is the simply X-ray of the bones and joints. And MRI, the MRI stands for magnetic resonance imaging. So radiography and MRI are commonly used for musculoskeletal diagnosis or to find out any disorder of musculoskeletal system. But here it is very important, if your patient has to go for any kind of MRI or X-ray, we have to educate them about the procedure. Like handle injured area carefully and support the extremity above and below the joint. So positioning is super important. Sometimes patients need a special equipment to maintain their body alignment. So we are RN, the nursing management we have to know. Nursing process including intervention to prevent the disability of the joint or body alignment. So during this process, most of the patient injured, so positioning important, right? And also if patient need special equipment, how they have to use it. So maintain the injured area, admit the analgesia for the pain management. Also remove any radio opaque object like any jewelries, wristwatch, right? Any kind of jewelries. Ask the client if they're pregnant. So radiography or X-ray is contraindicated in pregnancy. And also we has to know the client test, ovaries, and pregnant women. So a proper history is important before the procedure. Continuation, reinforce the instruction to lie still during a radiography. Yes, we has to educate them what they should do, and during the process they has to lie down, or if we has to check take the x-ray, they has to hold their breath and they has to stand during the process. Inform the client that exposed to radiation is a minimal for the diagnostic purpose, and it is not dangerous, because some patient has a phobia, because too much exposed to the radiation can cause cancer, but it is the very minimal for the diagnostic purpose, do not bad for the patient. And the healthcare provider must wear a lead apron if they stay inside the room, and complete a scanning process per, we has to follow the national guideline or agencies, right? So another, in during the MRI, which is also important, I just make a summary. So during MRI, we has to assess for the pregnancy. If patients are pregnant, they're not a candidate. So contraindication, the pregnancy is a contraindication. If patient has any kind of implantable chips like pacemaker, we has to find it out first. Also, ability to remain in one position for 40 to 60 minutes before MRI, you have to make sure, because some patient has a claustrophobia, you have to take the note. And also, if patient are very bad condition like nasogastric tube and they need the MRI, definitely we have to remove the nasogastric tube, okay? Or if patient has any birth control implant or patch, we have to remove before the procedure. And now go next, here is called arthrosynthesis. So arthroscopy and arthrosynthesis, we have to do this, know about this. Arthroscopy, basically we do for any kind of pathology, including the joint. So after the process, the swelling is very common, we have to tell your patient. And patient has to elevate the part after the procedure. In case of arthrosynthesis, basically it is a process we have to remove some fluid from the joint. So arthrosynthesis is used to diagnose joint inflammation and infection, right? So inflammation and infection, and also sometimes we have to remove the fluid from the joint by arthrosynthesis. It's called therapeutic. Arthrosynthesis involve aspiration synovial fluid, blood, or pus. A needle insert into the joint cavities. Medications such as corticosteroid may be instillated into the joint. Steroid. If patient has severely pain or inflammation very bad, we have to put injectable steroid inside the joint. We can take the help by arthrosynthesis. So what you have to know for the patient for reinforce or education, ensure that the inflamed consent has been obtained, apply an elastic compression band post procedure, and use the ice. So use or apply the ice to the area to decrease the pain, decrease the swelling. Pain may occur after aspiration fluid from the joint. Analgesia like aspirin, acetaminophen, naproxen, or other NSAID should be prescribed. In this picture, showing this is the knee joint, right? And here a needle is passing through the joint. And this is the ultrasound, ultrasonographic guided arthrosynthesis. Maybe they are removing the fluid inside the joint, or they're giving some steroid or any medication. And what next? Also, the pain can continue up to 2 days after admitting the corticosteroid inside the joint. Why we give the steroid? To reduce the inflammation if patient has any inflammatory joint pain. Reinforce, instruct to rest of the joint for 8 to 24 hours post-procedure. Resting of the joint is super important. And also tell your patient, elevate the part after the procedure. Okay. And also instruct the notify the primary health care provider if patient develop fever, redness, swelling, right? The little bit swelling or inflammation, or a little bit swelling or tenderness, redness, sign of the inflammation, and it is normal. But if the pain, redness, swelling with fever means it is infected, we have to inform healthcare provider. What next? Arthroscopy. Arthroscopy is used to diagnostic acute and chronic disorder of the joint. Arthroscopy provide an endoscopic examination, so ultrasound guided procedure. Articular cartilage abnormalities can be assessed. Loose the bodies can be removed or cartilage can be trimmed if need. Biopsy may be performed during the procedure. So if healthcare provider do, we can take some tissue or fluid for culture or any kind of histopathology. So what we has to know for educate my patient, re-informed the instruction to fast for 8 to 12 hours before the procedure. Everything we has to tell them. We has to explain the procedure. We has to tell them what are the indication of the procedure, what are the contraindication of the procedure, what are the side effect of the procedure, expected danger or side effect, important. Then if patient agree, you has to take, means healthcare provider has to take the informed consent, and you will be there as a witness because you are RN. So I said all is the procedure and part of any kind of diagnostic test or any kind of procedure. So monitor the neurovascular status, and also elastic compression bandage should be on for 2 to 4 days. So compression can help to reduce the inflammation. This is the one of the pictography showing the arthroscopic examination. So this is the basically ultrasound guided or source of the light, shoulder joint, arthroscope. Okay, so we can see, take the picture, and same thing or same time we can it is visible in the monitor. So reinforce the instruction that walking without weight bearing is usually permitted after sensation return, but to limit the activities, right? So when patient has sensation in the joint, the limited movement is okay, but not too much. Also, retraining instruct to the patient to elevate the extremities, right? Elevate the extremities is very important to reduce the inflammation or elevate the part post procedure. Also, regarding the use of the any kind of equipment, walker, scratch, or anything, maneuver is important. Keep the if patient has a joint, keep them elbow extended, limit the flexion to 30 degree or less. And what next? The another test is important here is called bone mineral density. Bone mineral density measurement. So if you want to know the bones erosion, osteoporotic change, or distribution of the calcium and phosphorus, we can do this test, bone mineral density, right? So dual energy X-ray absorptiometry, okay, and another way is called quantitative ultrasound. So measuring the bone's mass means content of the bones, mineralization of the bones, we can do by bone mineral density. And in this procedure, the radiation exposure is very minimum and is not dangerous. Used to diagnose the any metabolic bone disease, any kind of metabolic bone disease. So what is metabolic bone disease? If I said metabolic bone disease, right? So metabolic bone disease or other things is we have to monitor the change of bone density with the treatment, right? So as I told you, the bone mineral density we can do to diagnose any metabolic bone disease. So metabolic bone disease is an abnormalities of the bones caused by a broad spectrum of disorder, and most commonly these disorder are caused by abnormalities of mineral such as calcium, phosphorus, magnesium, or vitamin D, and they lead to dramatic clinical disorder that are commonly reversible once the underlying defect has been treated, right? So some of the bones mineral disorder are genetic or hereditary, like hypophosphatemia, or I said hypophosphatemia may cause the metabolic bone disorder like osteomalacia. So again, I said in the disorder section, we will be talk all of the disease about this. So quantitative ultrasound evaluate the strength, density, and elasticities of the various bones using ultrasound rather than radiation. Inform the client that procedure is painless. Otherwise, patient feel phobia, anxiety, what is going on with me, right? So now we are going to talk about the bone scan. So this is the radioactive materials are injected to visualize the bone in case of bone scan. A bone scan is used to identify, evaluate, and stage of the bone cancer basically. But keep in mind the radioactive materials injected to visualize the bones. Why? To identify, evaluate, and any stage to see osteocarcinoma, right, or cancer. So it is also used to detect any kind of bones fracture. Radioisotope is used intravenously and will collect in area that indicate the abnormal bone metabolism and some fracture. Isotope is excreted in the urine and feces within 48 hours and is not harmful to others. What are the intervention? Food and fluid may withdraw before the procedure, and should that informed consent has been taken, and remove all jewelries and materials. Keep in mind, informed consent taken by the doctor. What is your rules? You will be there as a witness. You will make sure doctor has taken the informed consent before the procedure. And other intervention from 1 to 3 hours after the injection, have the client avoid to clean access the isotope from bladder before scanning. So tell your patient to take enough fluid so the radioactive substance should be cleaned out from the body. Inform client to need to lie supine during the procedure and make sure it is not painful. Monitor the injection site for any inflammatory change, redness, swelling, tenderness, or fever. And also encourage oral fluid intake so that the radioactive substance should be expelled out. No special precaution are required after bone scan because a minimal amount of radioactive substance are injected for the process or procedure. So now go bones or muscle biopsy if necessary. Bones or muscle biopsy. So here a biopsy may be performed during the surgery or through the aspiration or pinch or needle biopsy. So biopsy, if patient need to collect, if we need to collect the tissue for any differentiate the pathology of the disease, we have to collect the tissue. How you have to collect? You have to collect by needle biopsy or punch biopsy or aspiration biopsy. But it is a very simple technique, but what you have to know to educate your patient. Monitor for bleeding, swelling, hematoma, or severe pain. So before the procedure, definitely you have to take a good history. If patient has any kind of bleeding disorder, if patient is taking the anticoagulant, antiplatelet, right? You have to keep a note and need to inform healthcare provider. After the procedure, we have to check any kind of bleeding, excess swelling, hematoma formation, or severe pain. Elevate the site for 24 hours. They can reduce the inflammation. It can reduce the edema. Also apply the ice pack. Why? They can prevent to develop hematoma or reduce the inflammation or pain, destruction, or decrease the site discomfort. Monitor the site for any sign symptom of the infection, right? The most prominent sign of infection are the fever, increase the local temperature, swelling, redness, tenderness. Also inform the client that mild to moderate discomfort, right? It is very natural, mild or moderate discomfort should be there. But if you tell them before, at least patient will not be um, panic. So another diagnostic test is called EMG. EMG stands for electromyography, and EKG stands for electrocardiography for the heart. But EMG for muscle and joint, electromyography. So EMG is used to evaluate the muscle weakness. So they measure electrical potential associated with the skeletal muscle contraction. Needles are inserted into the muscle and record of the muscle electrical activities are traced on recording paper. Same as EKG. EKG, electrical representation of the heart muscle and presented in the graphical papers, right? Electrical activities of the heart muscle. But if we do anything except cardiac muscle, other muscle, this is called electromyography. So electromyography also showing the electrical events and traced on a graphical papers through an oscilloscope. What you should reinforce your patient or intervention. So instruction that the needle insertion is uncomfortable. Also instruct not to take any stimulant or sedative for 24 hours before the procedure, right? Restricted. Also client that slightly bruising may occur at the needle site. So some redness, some little bit sweating, pain or bruising because local tissue get disturbed. And also mild, and I'll just say can be prescribed for the patient. So as I told you, little bit recap. So diagnostic test, what we use for musculoskeletal function and disorder, I said radiography or X-ray for bones and joints. Then we do for MRI, magnetic resonance imaging. We do the bone scan. Radioactive materials are injected to visualize the bones. Then we do for arthroscopy. In case of arthroscopy, we tell the patient to apply the ice, and some little bit swelling is okay, little bit pain is okay, but we also tell elevate the part after the procedure. Another one we has to talk arthrosynthesis. Arthrosynthesis means sometimes diagnostic or therapeutic. So diagnostic, we can see or we can remove the fluid or we can collect some fluid for culture, right? Remove of the fluid from the joint, or if we give some steroid as injectable form is called therapeutic, right? So X-ray, bone scan, MRI, arthroscopy, and also arthrosynthesis. These are the most important diagnostic tool for musculoskeletal systems.